Hello, this is a brief recording regarding the longitudinal rotation at Jericho Road Community Health Center. I am Dr. Celino, one of the three preceptors for this rotation. Jericho Road Community Health Center is a federally qualified health center, which means that we are a community-based clinic that receives federal funding to provide care in underserved area. Our clinic provides service to Buffalo most vulnerable population that include individuals with low income, family living in poverty, refugee, immigrants, and we see patients regardless of their ability to pay. We have 5 clinic sites located in different areas of Buffalo. We primarily, as clinical pharmacy team, see patients at 2 of the sites. The services provided by Jericho Road include primary care, maternal health, dental service, behavioral service, and also pharmacy. Because of our unique patient demographic, we do have a lot of wraparound service to make sure that patients are able to get the whole patient care that they need and they are able to achieve their health goal. In addition to the clinical service, Jericho Road has 2 340B's pharmacy located at the Broadway and at the Barton location, which are where we primarily see patients. The clinical pharmacy team is comprised of Dr. Gina Prescott, Dr. Christopher Daly, and myself. And with us, we usually have our learner at various level of your training. We have P3 on the APPE rotation, as well as postgrad trainee that can be a resident or a fellow. We do have an integrated model where students get to be engaged in our day-to-day work. The services offered by the clinical pharmacy team include medication and disease state management, medication review and adherence counseling through a patient visit model. In addition to the patient visit, you should expect to engage in an interdisciplinary practice through the provision of drug and for service and consultation as needed. For the longitudinal rotation, you should expect to spend about 6 weeks providing direct patient care, as well as 6 weeks providing non-direct patient care, which may entail in-service, topic discussion, case presentation, and on the longer-term population health initiative and quality improvement projects. You will be an extension of the clinical pharmacy team. It is our expectation that you display professionalism in all of your interaction and engage in all the activity that we as preceptor provide. So on the day-to-day, you should expect to be reviewing patient charts in preparation for clinic visits, address patient and provider triage requests, conduct targeted chart review to provide evidence-based recommendation to provider as appropriate. You will be supporting the drug information and provider education initiative. And we do have a weekly topic discussion. You'll be leading a topic discussion that are focused on the common disease state that we see in clinic. And also as an integrated care model, you'll be participating in a layer learning model by engaging with your peer, collaborating, and sharing clinical learning. Also, lastly, we do have like the opportunity to document in the EHR. We do provide a lot of service, and you will be like documenting your intervention within the EHR and also outside of the EHR in a external tracking system, and you'll be trained on all of that. So our goal for the rotation, and these are like some all-encompassing goals. So by the end of the rotation, you should have expanded your clinical decision-making skill through the application of evidence and clinical reasoning. We expect that you will be providing patient-centered care, that incorporate individual needs, preference, value, and goal. And you should be honing your leadership and communication skill through effective collaboration with patient, caregiver, peer, and the interprofessional team. And also, we expect that you will be developing cultural awareness, empathy, and professionalism. These are some of the defined goals for the rotation, but we'll work with you to incorporate any additional goal that you may have. We receive students with like various career aspiration, and we try to work with them to make sure that they get the most out of the rotation and that the skill they develop here are transferable to whatever they choose to do after their AP year, may that be residency, fellowship, or even going into the job market. These are just a few quotes from our students' review for the site. As I alluded earlier, we do have an integrated model. So as a student pharmacist, yes, we are training you and you are learning, but you are actively learning. You will be in the room with the patient with us, and you have plenty of opportunity to take the lead and continue to like practice what you've learned in class and kind of like add on another layer of like the patient reality and know how to kind of like craft your recommendation in the real world setting. You'll have 12 weeks with us. So in addition to the clinical skill that you'll be developing, you'll be involved in like the administrative tasks that we do as the preceptor team. And we are confident that by completing all of the rotation duties, you will come out of the 12-week a very strong clinician with a lot in your tool belt to kind of like face whatever it is after graduation. I would say this is like a great fit for any student that is interested in ambulatory care, pharmacy, leadership, or even inpatient pharmacy, because we do a lot of like disease state discussion, although it's like more so I would say MK pharmacy, or I should say residency. If you want to go in residency, this is a great fit for you. So we are seeking enthusiastic student pharmacists who are motivated to provide care in an integrated care model, working with physician, advanced practice provider, and staff. We want students that are able to exhibit some level of cultural awareness, patience, respect, empathy, and professionalism. And it is an expectation that in addition to grow your clinical knowledge, you continue to grow your confidence, independence, assertiveness in working with patient and the care team. So if you have any question regarding the rotation or anything that I cover briefly here, please send us an email. And my request is that you email all of your preceptors. We work together, we collaborate, and with any question that you may have, so we can get back to you. One thing that I forgot to note earlier is we are in clinic Monday to Thursday, and Friday is a designated project day where students can close up any like pending item that happened during the clinic visit date and work on their longitudinal project or the QI project. So we do, although it is busy, you may hear from your peer, it's very busy, but we do have a balanced schedule that allow you to learn and to complete your task in a fair manner. So thank you for considering on a longitudinal APPE rotation with us at Jericho Road. We look forward to receiving your application. And if you have any question, please do not hesitate to email me, Dr. Daly, and Dr. Prescott. Thank you very much. Have a lovely day.